Hello everyone, thank you so much for being around. Thank you so much for waiting for this program. And in the program of today, we are going to look at our friend. We are going to look and understand the dynamics, some of the challenges that is faced in a person living with HIV. Have you ever wondered why is it that sometimes a person living with HIV end up with kidney failure? As we all know, the kidney is a very important element, a very important organ in the body system. Now, this is what I have to say. The kidney, we normally have two kidneys. That is the normal person, the anatomy. But however, when the kidney gets issues, it will result in two serious complications. Imagine, the kidney is responsible for filtering, removing all the waste products, balancing all the electrolytes, balancing the water. Like it also helps in the production of some hormones that are very important. The adrenal gland, the erythropoietin. Also, it helps in the pressure regulation. So therefore, the kidney is one of the most important organs that the body has. But sometimes the kidneys get issues. And in the video of today, we are going to look at what we call nephrolithiasis, stones. Have you ever heard of developing a stone in the kidney? Now, we are focusing. Let us look at how a person living with HIV can develop a stone which can eventually result into kidney failure. You get my point? First of all, thank you so much for always following. Thank you so much for always checking out for my videos. I urge you to go to YouTube channel, subscribe, make sure you watch the videos that we placed there. Make sure you always follow these platforms such that you can always get notified. And for consultations are highly welcome. For any questions, for any video that you want us to talk about, it is highly welcome and we always respond in time. Now, kidney stones. What have we ever heard about kidney stones? The question comes back to you. Now, sometimes this is what we call nephrolithiasis. It is also known as kidney stones. It is a condition whereby small hard mineral deposits form in the kidneys, and these stones are of different types. Of course, the stones could be calcium stones, could be uric acid stones, could be cystine stones, could be any other. There are different forms of stones. But however, the treatment options depend on the size, the type of the stone, as well as the severity of the symptoms. Usually, management starts straight away from pain management, hydration, medication that can help you to pass the stone, or medical procedures that can help you to remove the stone such that the kidney can regain its function where possible. Now, in people living with HIV, the risks of getting these stones is way much high. But before I go there, please, if you are a person living with HIV, make sure you always stay hydrated. You always have good and recommended diet from a nutritionist or a healthy professional where you get your medication from, or make sure if you have any underlying cause, you have any disease that you have, make sure it is also managed and you always seek medical attention. Now, first of all, HIV can increase the risk of forming kidney stones through different mechanisms, and one of the mechanisms is and increased risk of dehydration. Remember, in HIV, we have HIV-related diarrhea, we have HIV-related vomiting, or we have medication side effect that can lead to dehydration, or which can concentrate the urine and increase the risk of stone formation. Get my point? You remember we studied about, some of you here know about, have ever heard of solubility product. That was way back, chemistry. What? In O level. Solubility product, concentration, whereby some things precipitate out and form stones. This is the principle behind this. Dehydration, vomiting, it means the body is not as hydrated as well to dissolve some of the materials. Then in the end, it results into precipitation of some elements, resulting into formation of stones. And this stone could block a pathway which is very important for urine formation or for kidney function, resulting into damage of the kidneys, especially in a long time. Secondly, we have medication side effect. Certain medications can increase the risk of kidney stones, especially some of the medications used by people living with HIV. That's why it is advisable to always visit a healthcare professional, or in case you get anything, make sure you talk to your healthcare professional that is recommended by the Ugandan Ministry of Health, that is directed as per the government of Uganda. So then we also have metabolic changes. HIV can lead to metabolic changes such as changes in urine pH, which can increase the risk of stones. So, in a nutshell, as I'm concluding, please always make sure you stay hydrated, drink plenty of water to help flush out the kidneys. Secondly, manage medication side effect, work with the healthcare provider to manage any medication-related side effects. Then another, monitor the kidney function regularly, check the kidney function to detect potential issues as early as possible. So thank you so much for being with me in this video. Make sure you subscribe to our YouTube channel, Dr. Kampala. Make sure you always share these videos such that a common person, a person out there, a sister, a brother can understand. Thank you so much. For now, I have to say bye-bye until we meet in the next video.